to point out that so many of those sites, most of those sites were from the Innovators Network, so good job, team. Well, good job collaborating. Thank you for that. Speaking of those of you in the Innovators Network, or those of you who might not know what the Innovators Network is, let me tell you a little bit about it. The Innovators Network is a group of 43 VA medical centers, healthcare systems throughout the country who invest and concentrate on employee-driven, veteran-focused innovation. If you are from an Innovators Network site, can you raise your hand if you're an innovation specialist? Thank you. Let's give it up for these folks. All right. So these folks are here to support the design and development of employee-generated veteran solutions. And also, innovation specialists are the catalyst for the education of thousands of employees through teaching innovation competencies. Hopefully, you've been able to kind of experience some of the iNet magic and our folks during the sessions with members of our team and our community this week. Now, I am excited to present the annual Innovators Network Awards to 3 individuals who have excelled in the work that is foundational to what we do in the Innovators Network. First up, we have the 2023 Tanked Award. Yes, the Tanked Award celebrates the idea of agile innovation, the ability to pivot a solution, or also the incredible dedication to solving a problem no matter what obstacles arise. It's not a failure. You didn't tank, you learned, right? So I'm thrilled to announce Elizabeth Townsend as the 2023 Tanked Awardee. So Elizabeth is a vestibular audiologist who was pulled into you can come up here, it's less awkward, an HCD design team looking at falls on the Augusta Psych Unit. Traditional fall prevention methods aren't available in the population, but she knew there had to be a better way. Through HCD, she and a team came up with a concept for a wearable device to monitor gait with a mobile call button based on what they had learned from interviews. Initial market research was conducted, and it looked like a wide-open opportunity. She's like, it wasn't. Elizabeth was accepted as a Spark investment in FY22, learned more about the needs of the patients, explored additional populations, and made an initial disclosure to our friends in Tech Transfer. In FY23, Elizabeth worked as a seed investee with various VA resources to develop a functional prototype. In a meeting with some VA engineers, here's the twist, Elizabeth learned of another company already available and ready with a product who is designed to do almost exactly what she was trying to create with some slight differences. Even though her seed project came to a halt, Elizabeth and her innovation specialists contacted the company to explore a collaboration through iNet's Greenhouse Initiative to best meet the needs of our veterans. The Tanked Award does not signify a failure, but the ability to pivot and the flexibility of an investee. Elizabeth went through the process of innovation, which sometimes means the solution isn't what you thought it would be. However, Elizabeth found the right solution for veterans. She embodies the fact that sometimes it isn't about the solution or result you want, but putting in the work to find the solution that your audience needs. So, Elizabeth's ability to do this shows her strength of character. Please give her another huge round of applause. You're welcome. Next, we have the Investee of the Year Award. I am so pleased to announce that Suzanne Swerin from Cincinnati VA is the recipient of this year's 2023 Investee of the Year Award. This is a most deserving recognition for an awesome lady, an advocate for an innovator for veterans. The Investee of the Year is nominated by Innovation Specialist and then selected by me. This is the second year in a row that the investee came from Cincinnati VA. Give it up, Cincinnati. Very partial to Cincinnati. It's where my grandfather received his care, and so it makes me very proud as well. Suzanne had been providing bedside nursing care to patients for over 31 years, most recently 8 years at the PACU, at the VA in Cincinnati. She was selected and supported, mentored by the Innovators Network and her innovation specialist, and she incorporated everyday challenges into Frontline Solutions. That is her invention, a pillow on a roll or a pour. Suzanne has persevered through so many iterations of her innovation and pivoted with ease every time with a positive attitude. And product, as we mentioned a little bit yesterday during the panel in the morning, product development in VA is hard. And so despite all these obstacles, she's continued her discovery and created a product that is truly going to meet veterans' needs and I believe beyond. She has a relentless devotion to what she's doing, the energy she puts out, and the desire to make her innovation great, and also educating those along the way as a great mentor and coach. And her device is coming soon on the VA Entrepreneurial Product Marketplace, and I am absolutely positive that this is going to be one of those big hits, like I said, not only for VA and veteran patients, but throughout healthcare and a few other industries that if you ever have the chance to see a pillow on the roll, please do. You'll see why it will make sense for so many people, and I am very, very proud of Suzanne. Let's give it up. Last but certainly not least, I am pleased to announce the 2023 Innovation Specialist of the Year. So again, if you're an innovation specialist, please raise your hand. These people are my kings and queens and goddesses, and I love them all so much. All right, they're amazing. They are highly trained leaders of their facility's local innovation programs. As VA Medical Center employees backed with INET training, resources, innovation specialists are well equipped to understand the on-the-ground challenges and meet them with innovative approaches to aid frontline employees to develop creative solutions. Innovation Specialist of the Year finalists are chosen by leadership, but the selection is made by their peers. And I cannot agree more with this year's choice. The 2023 Innovation Specialist of the Year is Augusta Healthcare Systems Innovation Specialist, Kelsey Shaw. You. Come on up here. All right, Kelsey is not only a leader at her local site, but she is a leader throughout our network. During this last year, she elevated her local program in Augusta and also served as INET's HCD, Human Centered Design Lead. She went far above and beyond to support her fellow specialists in understanding and practicing human-centered design and serving as an HCD leader and representative throughout the entire VHA innovation ecosystem. To me, a good leader is a confident decision maker, an empathetic listener, creative spirit, and an eager learner. Kelsey isn't just a good leader within INET, she's a great leader. The difference is between good and great is that not only does she do those things, she's creative and empathetic, but she is trusted and she is admired by her peers. That is what makes a great leader. Congratulations, Kelsey. I'm so proud of these ladies, all of the VHA employee innovators in this role. It is not just the pleasure I get to serve veterans, but I also get to serve my fellow employees. So. Now on to the next award, the Robert L. Jesse Award for Excellence in Innovation. We will show a quick intro video and then be joined by Dr. Carolyn Clancy, the Assistant Undersecretary for Health for the Office of Discovery, Education, and Affiliate Networks within VHA. Thank you.
Well, good afternoon. It's a pleasure to be here with you today, and it's been so wonderful to see and hear about the innovative advancements happening at the VHA, some of which have been presented over the last couple of days. My name is Janice Jesse, and I had the honor and good fortune of being married to Bob Jesse for over 40 years. I was so lucky to have a front row seat to see how his fascinating and brilliant mind saw things in a big picture and visionary light. I know firsthand how much care and dedication he put into improving the care across all of the VA healthcare system throughout his 30-year career with the VA. After Bob's passing in 2017, we established a nonprofit organization in his honor, the Jesse Family Foundation, where we strive to carry on his legacy by adhering to his key values as a family man, friend, physician, colleague, and mentor. Our goal at the JFF is to empower today's healthcare visionaries to push the medical boundaries of tomorrow, which aligns so well with this award. To see the Robert L. Jesse Award for Excellence in Innovation established by the VA in Bob's name means so much to me and my family. Knowing that his legacy continues to inspire others is a tribute to his memory and one that would make him proud. I'd like to offer a huge thank you to all who dedicate your work towards a brighter future, and a hearty congratulations to all of the finalists for this award. So continue to dream big, be creative, and embrace the spirit of innovation. Thank you.
Well, I have to think that video from Janice Jesse really says it all. What almost no one here would know, I think, is that I actually taught Janice Jesse when she was a medical student. I didn't know that for many years later. I just remembered she was part of this group of incredibly brilliant women students, which in the 80s, having several in 1 month together was quite amazing. So, good afternoon, everyone. What amazing 3 days, and so many conversations and connections being made here. It's incredibly exciting. I am so pleased to join you today and honored to present this year's Robert Jesse Awards for Excellence. Every year I look forward to IEX, and each year my expectations are exceeded. This year is no exception. None of these advancements would have been possible without VA's most invaluable asset. That is all of you. Today, we celebrate your willingness to imagine better ways to serve veterans, your determination to make work easier for your colleagues, and your insights to strengthen VHA. It's really a special honor that's hard for me to capture in words to present these awards. Bob is really the reason I came to VA a little over 10 years ago. His passion for education and new ideas inspired me then and continues to inspire me now, as well as his many friends and colleagues. Here's a lovely excerpt in addition to Janice's comments. This comes from the Jesse Foundation webpage, which says it all. Above all, Bob was compassionate. Guided by integrity and kindness, he treated people with the utmost respect, regardless of their role or position. He was always willing to listen to a problem, take a call from a patient, mentor a student, or lend a helping hand to those in need. It struck me when I was here listening in on Tuesday sessions how much Bob's compassion for others is embodied by the work you're doing. His greatest gift, beyond his keen ability to envision the future, was caring for the individual, the patient, the veteran. I know he'd be incredibly proud to see the work that has been showcased these past 3 days, and as a lifelong learner, would be especially pleased about the many sessions featuring innovators passing along their experience to new innovators. IEX is a home where the best and the brightest in innovation come to celebrate accomplishments and provide a glimpse into the future. That, too, is something Bob would have been really excited about. VA is a home for innovators with IEX as its annual celebration of accomplishments. So the Robert L. Jesse Award Series was established in 2019 to honor Bob's legacy and dedication to veterans. Before he was appointed Principal Deputy Undersecretary for Health in 2010, Bob was the Chief Consultant for Medical Surgical Services in VA's Office of Patient Care Services, also serving as the National Program Director for Cardiology. In this capacity, he implemented broad reforms in the delivery of specialty, subspecialty, and emergency care that have significantly improved the quality of care provided across the VA healthcare system. Throughout his VHA tenure, Bob's vision, commitment, and his dedication to innovation were evident to all. The Robert L. Jesse Award for Excellence in Innovation honors 3 categories of VHA employees: clinical, non-clinical, and team. So we're going to start first with the Clinical Excellence Award to Dr. Mark Holodny. The first award recognizes a current VHA clinician who's developed innovative solutions to delivering patient care, resulting in improved access, quality, continuity of care, and/or patient outcomes. So I am really, really excited that this year's recipient is Dr. Holodny. As the director of the VA's Public Health National Program Office, Dr. Holodny oversees a diverse portfolio of initiatives that are integral to the health and well-being of veterans across the nation. This includes, we would be here all day if I included everything, just saying, managing the VA's Public Health Reference Laboratory, public health surveillance, climate change and veteran health, medical countermeasures, and public health pandemic preparedness programs. Throughout his 30-plus years with VHA, Dr. Holodny has demonstrated an unwavering commitment to advancing public health and improving veterans' lives. During the 2009 H1N1 influenza pandemic, Dr. Holodny established the VA's National Public Health Reference Laboratory, which offers surge capacity testing in VHA when clinical laboratories become overwhelmed. Today, that laboratory provides complex clinical testing for infectious diseases and plays a crucial role in outbreak investigations at VA medical centers. Notably, this is due to molecular sequencing technologies not being available at local VHA laboratories. One of Dr. Holodny's most notable achievements, and among the many reasons we're recognizing him today, is the development of groundbreaking software tools that predict and address emerging pathogens and their potential impact on veterans' health. Through collaborative efforts with a myriad of partners, he has harnessed the power of cutting-edge AI and machine learning to enable the creation of robust predictive models. That is, models which facilitate proactive responses to climate change-related health concerns, as well as emerging outbreaks. A key innovation here is the public health surveillance software, which is invaluable for early threat detection and situational awareness. By analyzing extensive data sets, this tool identifies patterns and trends of public health significance, providing visualization of infections, their distribution over time, geography, and demographics. This significant advancement has improved public health surveillance, enabling timely interventions to safeguard the health of our veterans. Using this same underlying principles, Dr. Holodny is also spearheading the development of a climate change data tracking tool, which leverages statistical models, machine learning algorithms, climate data, social determinants, and pathogen information to predict future climate trends and health risks. This tool equips researchers and policymakers with critical knowledge to safeguard veterans' health in the face of climate change. Dr. Holodny has demonstrated time and again the importance of rapid innovation before and during times of national crisis, leaving an indelible mark on public health. His outstanding contributions have not only improved the value of veterans' care, but also have positioned VHA as a leader in innovative healthcare practices. Congratulations, Mark. I hope you will all give it up for Mark Holodny. And if you could join me on the stage for a picture. Wow. Our next award in the non-clinical category, and by the way, for all you innovators, if someone comes up with a better word than non-clinical, please email me anytime. This award honors a VHA employee who demonstrates excellence and promotes innovation across the enterprise, either at a VA medical facility, Veterans Integrated Service Network or VISN, or VHA program office level, and has demonstrated excellence so to garner recognition from his or her peers. Dr. Indra Sandal has done all of that and so much more. Those of you who've had the privilege of meeting her will know she is a force of nature. Yesterday, many of you heard her speak at the breakout session about the VHA Uber Health Connective Initiative, or VUHC, which is redefining veterans' access to care. Dr. Sandal's dedication to improving veterans' mobility experience and healthcare access is beyond outstanding. She began the VUHC program as a 2021 entrepreneur in residence with VHA Innovation Ecosystem Fellowships. What started at a pilot project at 10 VA medical centers has now expanded to 68 new facilities in 18 states and Puerto Rico and continues to grow. The primary goal? Providing eligible veterans with supplemental transportation options to and from their medical care, ensuring they receive timely and high-quality health care. From January of 2022 to September of 23, VUHC has offered over 94.7 thousand rides to veterans. This would be equating to about 1.4 million miles, and has saved VA over $110 million. But the true measure of success lies in the feedback it has had on our veterans. Over 2,300 participants have shared their stories, with 83% of veterans saying they wouldn't have been able to access their medical care without the VUHC program. Further, an astounding 90% would recommend VUHC to other veterans. The immediate and tangible impact on veterans' access to care is crystal clear. The success of the program is testament to the dedication of VA staff and transportation teams who've worked tirelessly to make this initiative a reality. The ability for veterans to request a ride has been a game changer. As we look to the future, the expansion of the program means that more veterans across the country will have increased access to reliable transportation and fewer barriers to care. As a trailblazer of non-clinical innovation, Dr. Sandal has transformed veterans' healthcare access by addressing one of its most formidable barriers, transportation. Thank you so much, Dr. Sandal, for your leadership. Please join me on stage to accept your award. We always say this is a team sport, so I'm sure it is not lost on you that rather than saying, whoa, Dr. Sandel immediately said, get the team up here, we need a picture. So, the third Jessie Award honors a current clinical or non-clinical department or team who demonstrate excellence and promote innovation across the enterprise of either a VA medical facility, VISN, or program office. I'm pleased to announce that this year's award goes to the Care, Treatment, and Rehabilitative Service, that it would be CTRS team, Alan Trin, Shannon Santini, John Kewen, Matthew McGarren, Sally Hammett, and Acting VISN Director Dr. Stephen Braverman. Together, the CTRS team dedicated themselves to addressing one of the most complex, multi-layered challenges of veterans' healthcare, addressing the needs of homeless veterans. Their commitment to navigating the legal, social, and other major barriers has been remarkable. As an aside, I will simply say that the politics of where they have been doing their work cannot be overestimated, not possible. Their initial conception of providing emergency shelter for homeless veterans within VA property was met with a lack of legal authority. COVID emergency authorities opened the door to pilot a program for veterans to come onto campus and set up a tent in a parking lot to stay close to medical care and provide stability. And thus, the CTRS program was born. What started as a humble solution grew into something extraordinary. The CTRS team provided wraparound health care and supportive services, along with security, food, and shelter. More than 50% of the veterans advanced to transitional or permanent housing, a remarkable achievement in reducing veteran homelessness, especially if you're doing your work in one of the most expensive zip codes in this country. The team then faced restrictions on using appropriated funds for housing, and in response, set up donations and local partnerships to provide large tents, later transitioning to tiny shelters. In fact, I owe it to this team that every time I get on Facebook, I'm seeing lots and lots of photos of tiny shelters and tiny houses. This extraordinary commitment in and of itself led to recognition earlier this year by our National Center for Healthcare Advancements for Partnerships office within Dean, which honored the program with a 2023 VHA National Community Partnership Award. The tiny shelter community now provides non-congregate housing for 140 veterans, with 6 drop-in shelters for overnight care and placement. Importantly, it has also served as a bridge site to help find options for veterans who had formed a large homeless encampment outside of VA. Over 1,000 veterans have benefited from this program, with a 62% placement rate to higher levels of housing or treatment programs, including 57 veterans who were reunited with their families across the country. The dedication and contributions of each CTRS team member have been instrumental in making this initiative a reality. Together, they show us the power of teamwork to improve the lives of every veteran, redefining that this is a team sport. I'd like to invite each of them on stage to accept this award. And now, don't get too comfy, I'd like to invite all of our Jessie Award recipients to join us just one more time on stage. Thank you for your dedication to our veterans and showing us the power of innovation. to transform healthcare. Congratulations to you all. So I have one more announcement before making some closing remarks. I want to speak for a moment on the important role that veteran service organizations play in VA's innovation work. As you heard during our community builder, Matt Rowley's IEX talk at the close of day one, it's critical that VA use the voice of the veteran as its North Star when innovating the future of veteran healthcare. VSOs have vast reach and influence both among the veterans community and in Congress, and allow us to reach beyond the four walls of our VA medical centers to learn about what matters most to veterans that don't receive their health care through VA. When we innovate with knowledgeable and powerful external partners like VSOs, we're equipping VA to lead healthcare innovation in this country. So building on the theme, as we did for Dr. Jessie, of honoring leadership that was just absolutely exemplary, I'm excited to announce the Gary J. Augustine Award, which will be given next year at IEX, honoring VSO's collaboration on healthcare innovation. Gary worked for disabled American veterans for many years, a disabled veteran himself. I first got to know him the summer of 2014. This was something of the summer of living dangerously, a very tough time with our access crisis. And the first time I met Gary was at their annual meeting in Las Vegas. I was almost run over by one of their people in wheelchairs, right? Because a lot of them had these electric wheelchairs and they were zipping around these casinos, and that and time change didn't quite all work for me. And he was very anxious because he'd just become executive director. What's going to happen now? His dedication to serving veterans and motivating and leading others to do so was just almost beyond description. And it was truly a family affair in his house. Tragically, he died 2 years ago, which was just incredibly sad for all of us who knew him, of a pretty horrendous cancer. And so honoring that legacy and honoring all the work our VSOs do with veterans, I can't tell you how much we're looking forward to making this first award next year. So for those of you in the audience from VSOs or connected to them, please spread the word. There will obviously be more information coming later, but just really, really an exciting moment for all of us. So as we close out this year's IEX and reflect on the last 3 days, there's a lot to think about. My challenge question to you is this: how do you take the new experiences, lessons learned, and connections made this past week and put them to work for veterans? So let me suggest a few answers. First, spread the word about VA being a home for innovators. Apply your innovative skills to help us interest more frontline staffers and hire more team members. As all of you know, VA is an exceptional place to work. No other federal department has a mission as noble as ours, and no other organization, public or private, can offer new generations of innovators, researchers, and clinicians the opportunity to use cutting-edge technologies to improve patient care. Some of you have probably heard me say this before, but it bears repeating. Several years ago, during an interview with CNN's Anderson Cooper, acting OHIL director Dr. Beth Ripley, understand this was the first year that the Service to America medals are being offered during a pandemic. There is no big gala affair and so forth. It's all Zoom. 2 people are chosen to be interviewed by Anderson Cooper, and was he smart to pick off Dr. Ripley? She's telling him about his work and about her work, and he finally says, well, ultimately, wouldn't you be better off in the private sector? And without missing a beat, she says, no, why would I want to do that? I would never be able to do the amazing work that I've been able to do at VA. I can't think of better recruitment material. My husband said, if you can bottle that, you guys are totally good. Second, stay veteran-focused. The advancements and initiatives you've heard about these past few days are game-changing, and they demonstrate your exceptional ability to fully appreciate the wide spectrum of healthcare needs from the veteran's point of view in developing, scaling, and replicating innovations nationwide. This is all about meeting veterans where they are. Not where we think they should be, but actually where they are and what they need. And in the wake of our excitement about these innovations, we must work to stay centered on veterans and ask ourselves, do these advancements truly work for patients? Are they understandable and easy to use by all groups? Do they work for providers? As the nation's largest integrated healthcare system, we have the unique opportunity in VA to explore these questions, as well as many others yet to be identified. Third, stay curious. Whether you're new to innovation or a seasoned innovator who facilitated sessions at this event, I'm certain the past 3 days have been informative and perhaps transformative. I encourage you to apply what you've learned in seeking new ways of envisioning care and services for veterans. Ask questions and feed your passion for learning and innovation. I hope you've made new connections and are feeling inspired and equipped to expand the role and value of innovation. And I hope you are as excited to have found your home for innovation in VA. So in closing, let me just leave you with the words of Alan Turing, the great British mathematician and computer scientist. We can only see a short distance ahead, but we can see plenty there that needs to be done. Our work is only just beginning, and I truly cannot wait to see what lies ahead. Thank you very, very much for everything you're doing for veterans, and safe travels home.